besides formal training given to the nurses in the high institutions and the doctors.
Yes.
In China, they used to have, I don't know if they still foot
doctors,
yeah. Which is AKA community health nursing.
That's correct, yes.
Is that still viable here?
It's still viable. Again, centering on primary care. Yeah. Let's take malaria. How do you diagnose malaria? I've got a temperature, I've got a fever, okay? Diarrhea. How do you diagnose diarrhea? It's obvious. What's the treatment for malaria? Tablets. What's the treatment for diarrhea? Replace the fluid loss. Somebody trained to do this. Doesn't have to be a doctor, doesn't have to be a nurse. They know what to do and how much to give for a child who's 1 to 2.
But has that training been, has it been?
No.
Is there a need to tweak the curriculum a bit?
This is where we have to look at the training.
Because if you talk about funding, you have to look at the...
This is where you have to look at the personnel required to deliver your service. Who do we need to deliver a healthcare service in the primary health centers? You may say in certain areas you'll have a nurse or 2 nurses, but what about the support workers? What do they do? Where I practice, nurses and doctors no longer take blood pressure. The people who do the vital signs are not doctors or nurses. They're healthcare workers who have been trained on how to do it. So it's not rocket science. And that's where we should look at. Again, doing that will create a lot of employment. In the rural areas, people live in rural areas. Some go to school up to primary 6, what we call JSS. They can be trained to do the basic things. And when you have guidelines to say, when you cross this, if you've given this tablet and your patient is not getting better, refer on to the next level. That's where you have the flow process. I don't think you need doctors manning primary healthcare centers. Yes, they may visit, they may oversee what's going on. And again, it's just a wide area, telemedicine. We've all got mobile phones. I'm in the primary healthcare center as a health worker. I have a problem. I know I can telephone the general hospital. I know I can call another person. So using telemedicine, IT facilities will enhance that flow process.
Okay, now let me take you to one area that I know doctors don't like to talk about. And one issue that is also part of what is dragging Nigeria's health sector back, I would say, is the strike. You have health workers going on strike for almost anything that they think, it's not going down well with them. How do you think this has also impacted on the health sector and patient safety and things like that?
Well, going on strike in Nigeria of recent has become very embarrassing. It's terrible. And it is because the system is disjointed. It is because even the policymakers themselves don't know what they want. And because of that, it has created a lot of systemic opera. All right? And when you even try, to suggest a way forward, the next thing that happens really shocks you, okay, in the health sector. Right now, there's some strike going on that is absolutely preventable. Because when people look at it, you blame those people who have gone on strike. And it's not, it doesn't favor them either. If you make a policy, I have this policy, this is how I want this thing to run. And then 2, 3, 4, 5 years later, the thing has not been implemented. What do you expect will happen? Or you have somebody coming and shouting at you, I want it done, I want it, and you don't think about the process that follows, and you do it, and you change things, and then somebody else reacts and you say something. But for just telling you that in where he practices, doctors don't take blood pressure anymore. Doctors don't take blood. We have those phlebotomists who take blood. And then the person says, look, I'm the one taking the blood. I'm the one taking the blood pressure. Doctor just look at it. Therefore, you have to remunerate me exactly what you are remunerating the doctor. And when the doctor to go to sleep and say, yes, that is right. And the government say, yes, so that is right. That's one of the problems that is going on. The government should have a plan for the health system, and every worker should know where they belong. In developed country, everybody knows where they belong. I went to a hospital in developed country. The very person I was talking to was a nurse practitioner. And it's a highly specialized center for they treat oncology there. And immediately I started talking to her. I said, sorry, doctor, I'm not a doctor. I'm a health practitioner. You have that system in Nigeria, the person say, yes, I'm the head of this place, I'm the doctor in charge.
Really?
Yeah, that's what is happening.
Because if you're not a medical doctor, you're not to claim that
in Nigeria, they do claim it, and that is part of the issue.
They will tell you that that's not the case.
I'm sure of what I'm talking about in the system. I'm practicing in the system. So that creates a lot of issues. And when you try now to correct and there's issue, then delay in implementation of policies is one of the things. And the government has to be proactive. For example, if somebody is talking about I just bring a national minimum wage. The government can say in 2017, I'm going to implement this national minimum wage that has been approved in 2015. Then the government budgets for it and plans for it. And 2017, you start implementing. Now what we find in Nigeria is that, okay, national minimum wage, okay, you're fighting for it, I will backdate it for you to 2013. What you didn't budget for in 2013, it now creates a huge burden on the government to implement. And then you have strikes.
When you say the government will say will backdate it for it, it's sometimes the unions that demand for a
backdate. But I am the government, I'm negotiating with you. I should be able to tell you, there's no reason why a government should backdate remuneration. It is wrong.
Let's find
because
out
from let's just say something about this training of workers in the health in the primary care. There are training going on all over the place in the country. When they get to the state after training, I know there's a particular school where we train them at Lagos Station Hospital. They post them. Some of them post them to the ministries. Some of them to the secondary centers, and they don't post them to the primary centers. When I was training Igbo,
why did they do that?
It's the disjoint. People don't even know what they're training people for.
So, Professor, how is it? In where you practice in
England. In England.
Why is it that you don't get to hear that doctors or health workers go on strike? At least I think the last one was very brief. I think
yes,
1 hour or so.
Yeah. I think doctors, nurses, people in healthcare, strike should be the last weapon or option when there's a dispute with government. It's not something you use, and we don't go into the health